thank you for the invitation. I just start to speak about a collaboration of hospitals who do integrative oncology, included mostly into cancer centers. It's the KIM, the Competence Network of Integrative Medicine Baden-Württemberg. And I'm very happy that Minister Lucha, who gave the video message at the beginning of this session, he is our, he really protects this. He is doing the patronage for us. So the Foundation Act of the KIM happened end of November 2017, and 1 year before we had intensive talks between the different hospitals that you can see here on the list. These hospitals represent, let's say, hospitals on the level of community hospitals, teaching hospitals, oncology centers, and cancer centers. And when we started, we did it under the patronage of the State Secretary Bärbel Mielich in the Ministry of Health in Baden-Württemberg. That was an experiment, something like a consortium of integrative hospitals in Germany or in Europe did not exist to that time. So it was completely new, and we were all keen to see how it would work. The founding members, as you can see here, are well-known hospitals in Baden-Württemberg. That's the federal state in southwest Germany. You can see the university hospitals, you can see other hospitals, that was a little photo, some impressions from the type of the hospitals. And in the center, you see the Foundation Act with the minister or the state secretary, Bärbel Mielich, just in the middle of the group. So what is interesting that in the KIM hospitals, different complementary traditions or traditional traditions in medicine are provided. So it's acupuncture and Chinese medicine, anthroposophic medicine, naturopathy, different types of nursing, manual therapies, art and music therapy, other mind-body therapies and yoga, mindfulness techniques, nutrition, integrative patient counseling. And so what we did, or the question that led us, was how we can integrate the integrative therapies. Yeah, so how to create sustainable models for an institutional implementation on a larger scale. So the question was how to identify best practices from the whole field of complementary medicine and to offer that to hospitals who wish to implement integrative medicine. And of course, when we started, or even before we started, we had to agree what does integrative medicine mean for us as a hospital consortium. You may know that there are different definitions around the globe what integrative medicine is. And we decided that we create, let's say, a working definition for us. Yeah, something that fits really to the KIM, to the hospitals, to make very clear what we mean when we talk about integrative medicine, and of course what we do not mean if we talk about that. So for us, integrative medicine meant that complementary therapies are integrated into specialized hospital units. That's not for granted if you look around the globe. That's something that's really a decision to say we want to have a full integration. And we said, of course, it's about a meaningful combination of conventional and complementary methods. And what does it mean, a meaningful combination? That means, of course, that looking at the patient needs and patient symptoms, that it makes sense that you can do something with the complementary therapies, what you can offer to the patient that is not covered by conventional care, and the other way around, of course. Yeah, so it's not neither nor, it's both. And the question always was, where is the added value for the complementary therapies? And then we decided that it's performed in interdisciplinary teams, which are led by a medical doctor with a double competence. So a doctor who should be trained in conventional medicine as a specialist, oncology, internal medicine, whatsoever, and a good training in at least one of the complementary traditions. And of course, we said that we work on a scientific basis by means of evidence-based medicine. But of course, we said clearly that we want to have all the three pillars of evidence-based medicine. We will come back to that later on. Today, after 6 years, you can see that there are much more members now. We are approaching the number of 20. So it was successful. So it was attractive for hospitals who looked at us and said, wow, that's really interesting. That's something meaningful. We would like to offer the same things to the patients. We would like to be part of the team. Today, our patronage is given by the Minister Manfred Lucha, who is the Minister of Health in Baden-Württemberg. And here you can see a picture of the federal state of Baden-Württemberg in the southwest of Germany. So looking at our structure today, there are 19 hospitals and outpatient centers, 2 academic research centers. Hospitals cover university hospital, teaching hospitals, and 3 general hospitals. And then it's interesting to look at the structure of cancer care. So we have 2 comprehensive cancer centers. That's the highest level of cancer care in Germany. There are only 12 in all of Germany, and 2 of them are in Baden-Württemberg, and both are members of the KIM. And then on the other hand, we have 3 specialized hospitals for integrative medicine. So hospitals with a long-lasting tradition of more than a decade who took a decision quite early as pioneers to say, we will offer integrative treatment to patients. And this combination is very, very meaningful concerning mutual learnings. We have a collaboration with an academic center for complementary integrative medicine, Baden-Württemberg, and there is public funding for both of us, so for the KIM and the so-called ARTS-KIM, with about 1.1 million euro for 2 years given by the government of Baden-Württemberg within a program that is called Healthcare Location Baden-Württemberg, where the federal state decided to look where are specific strengths, where are innovations that should be fostered, that should be supported, meaningful innovations for the future. And we are very happy and a bit proud with the KIM that we are part of this community. So the last hospital coming in now that will be decided by end of July is the Stuttgart Cancer Center. That's, I think, one of the biggest cancer centers in all Germany. The SCC, Stuttgart Cancer Centers. There are 3 big hospitals, 14 organ centers, more than 11,000 cancer patients treated there per year. And it's interesting that the colleague, a well-known colleague of us, Julia Gottfried, who worked in one of the smaller specialized hospitals before, that the structure there now is that in all tumor boards, integrative treatment recommendations can be given, and there is an additional specialized integrative tumor boards for specific questions, specific patient support every 2 weeks. So that's quite innovative. With these hospitals, with these another 3 hospitals, we will have taken the number of 20 then. So looking at how the KIM works, how it is internally organized, you can see, of course, there are the KIM members, the KIM plenary assembly, from all hospitals. It's important to understand that it's not a working group who becomes a member or a doctor specialized in integrative medicine. No, the hospitals with their hospital leadership, they decide to be members. Yeah, that's let's say that's very helpful because hospitals take a decision to be visible in the field of integrative medicine. And of course, they have to agree that people who are active in the KIM working groups, for example, that they can do that during their normal working time to work for that, because it is part of the hospital, of the strategy of the hospital. So the KIM members in the plenary assembly, then we have a steering group, that's a coordination group, 5 people, nurses and medical doctors, research. The steering group meets every 2 weeks. Then we have the working groups in oncology for medical experts, so medical doctors, for nurses. And then we have a working group for infectiology that is interdisciplinary. And these working groups work about best practices and recommendations for implementation. And then we have a methodology team that's very important for us, that is active on the level of documentation, evaluation, publication. It's a scientific collaboration with the Academic Center for Complementary Integrative Medicine in Baden-Württemberg. And then the KIM has an expert pool that is, that can work, that can deliver experiences, knowledge, skills, for hospitals within the KIM and outside the KIM. That's for training, for counseling, for job shadowing. So that's our structure. And what we do when we work about best practices, first of all, we take a symptom-oriented approach. So in oncology, we do not work on different cancer entities. So for example, breast cancer, and then pancreatic cancer, and then lung cancer. No, we work on, for example, cancer fatigue, which is a symptom, severe symptom for all cancer patients with different diseases. Or we work about nausea and vomiting, weight loss, loss of appetite, mucositis, so an inflammation of the mucosa, most often into the mouth or in the intestine. There we collect first what are the specific medicinal projects, nursing therapies, acupuncture, mind body therapies, aromatherapy, and so on. We collected what is in use in all the different hospitals. And then we try to identify the best practices. So we look for effectiveness with a scoring scale from 1 to 5. The training needs, that's very important, that a new hospital who wants to implement an integrative methodology, they have to know, what does it mean? Is it a long training that doctors or nurses would need for that, or can it be done in a very, very short time, for example? Costs and time is something that has to be scaled, and feasibility. Feasibility, for example, means, do you need special rooms or special staff or anything else? And of course, we combine all this with external evidence, with scientific publications, assessment of side effects and interactions, so that we have a mix of internal and clinical expertise and external evidence. That means studies that are published. And maybe here it's a good moment to reflect that evidence-based medicine actually means that we have 3 pillars or 3 circles that have to get together. That's a question of the best research evidence, what the literature says, the clinical expertise, or what is called internal evidence, what teams know, what the clinician knows. That's about skills, that's about how to do it exactly, that's about the knowledge about the application, and so on. And of course, very important, the patient value. So we always have to do what fits to the patient priorities. And what we learned during our work in the KIM is that not only for external evidence, you can describe, let's say, something like a pyramid. Yeah, that is very well known. You see it on the left side. So you have case reports as a very weak level down there, and you have meta-analysis and randomized controlled trials very up high in the peak of the pyramid. And what we did is that, of course, we did even not start with single experiences, so single doctors saying, I always do this and that, and I have good success. No, we started to collect the experience of hospital teams. And then we brought together a multi-center team expertise. And we used standardized criteria in a Delphi process to identify what are really the best practices and best practices for easy implementation. So it was about easy to teach, easy to learn, and easy to implement, and from all the different complementary traditions. And the final stage was then the interdisciplinary assessment and the identification of 5 different therapies for each main symptom. So to deliver for other hospitals who want to implement what they can start with. So sorry, that's all in German. These are the best practice recommendations for, yeah, that's in our final report that we had to write for the land, the federal state of Baden-Württemberg, in the end of the funding period. And then we put it in very clear, sharp practice recommendations that are easy to download on the internet, just in German. Sorry to say that for the moment, may be different in the future. And so with these 20 treatment recommendations, we wanted to deliver something like a starter kit for integrative medicine, which allows hospitals to start small, to have the basic level, then to build up the experience, then to decide other more specialized techniques that they want to use for the patients. But these 20 treatment recommendations for cancer patients are really a basic starter kit for the first steps in implementation. So final slide. We are very, very happy that we were on the screen of the Krebsverband Baden-Württemberg. That's the federal organization of the German Cancer Society. And it's called Baden-Württemberg Cancer Association. So this is really the organization covering official oncology expertise, so the oncology centers, guideline experts, doctors, nurses, palliative care specialists. They are all organized in working groups. The working groups work together under the umbrella of the Collaboration for Transdisciplinary Oncology, the ATO. And there were, until now, 10 different working groups bringing in the expertise of the experts in the field. And now a new working group for integrative medicine and nursing was founded. And we're very happy that the Krebsverband Baden-Württemberg approached the KIM, said, would you like to be the starting point for that? Of course, other experts outside the KIM are warmly invited to collaborate there with us. But in a way, we can see that at the moment, having worked on the recommendations, having been funded by the federal state of Baden-Württemberg with the patronage of the minister, and somehow being arrived and warmly welcomed within the institutional oncology networks. That's a big pleasure for us. And I hope that these experiences in federal state of Baden-Württemberg can be somehow stimulating, maybe a model in a way for what we can do on the European level in the future, yeah, to bring best practices together and to do it in a way that is very acceptable. And of course, the Kim will be happy. It would be a pleasure for us to contribute there if on the European level we would have something like a collaboration of experts. So thank you very much for your attention. It was a pleasure to speak here, and all the best for the continuation of the meeting.